Ehlers Danlos Syndrome is a genetic defect in connective tissue due to faulty or reduced amounts of collagen. Many EDS sufferers in Australia are being misdiagnosed as some doctors are unaware and unfamiliar with the syndrome.
EDS is one of those conditions, unfortunately, which is poorly recognised, and because of that, it makes it very difficult to be able to identify and provide a treatment plan. With EDS, they can present with very non-specific symptoms, so they can have often a lot of muscle weakness, malaise. They can have problems with feeling fatigued. Those are very non-specific symptoms that are characteristic of patients with EDS.
Like many other EDS patients, Sam Payne encountered various health complications that were unexplained for a long period of time before he was correctly diagnosed with EDS.
I was diagnosed with everything from chronic regional pain syndrome, which is very common in EDS, to I was told it was a product of my anxiety. I also was told quite a few times that I was depressed and that was actually causing the illusion of pain. A lot of doctors also suggested that it was the fact that I wasn't either eating or I wasn't exercising to the point that I should be to be building up muscle.
Undiagnosed, it can lead to a whole host of complications. So of course, the skin can be affected, the bones, the blood vessels and other organs, including the gut. So it's really important, especially for young people, it's very important that it's diagnosed early, because otherwise there can be a whole host of complications that people can develop over time and untreated. And a good example of that is when they can present with often very frequent joint dislocations, which can progress to chronic joint damage.
Sam was the one that diagnosed himself. So he came out with a list of things that he'd highlighted and said, I think I have EDS. And I looked at the odds of him having EDS and I said, oh no, you don't have that. And we were under the pain clinic at the Children's Hospital, and Sam took that paper that was all highlighted and showed them, and they said, oh no, you won't have that, but we'll give you a referral to a rheumatologist. And the rheumatologist saw him for about 10 minutes and said, this is the easiest diagnosis I've ever made. You have EDS. So Sam actually diagnosed himself, and that came about by being so frustrated that the medical profession wouldn't listen to what he was saying.
In May, researchers gathered in New York for the Ehlers Danlos Society International Symposium with the primary goal to redefine the standards for diagnosis, testing, and clinical care for EDS patients.
Criteria, for example, the Villefranche criteria, which is an important criteria that's been used for a long time with EDS patients, hasn't been updated recently. It doesn't take into account, for example, gastrointestinal complications. We know that gastrointestinal symptoms and complications are a very important part of someone who's affected by EDS. There is a need for revision of the current criteria, and that's where having conferences such as the conference you mentioned is very important in terms of building consensus among sufferers and also clinicians who deal with patients with EDS.
Now that Sam has regular physiotherapy and help from other specialists, he was able to achieve his dream of playing contact sport again.
That's where it really started to become real to us, and we had a name for it so we could do things about it. We were aware of it, and we could start addressing some of the issues that we didn't know were EDS related. I was able to see a sleep specialist. I was able to see a physiotherapist and a hydrotherapist often and get some of the muscle built around the joints that were severely affected and reduce some of the damage I was doing daily, which I didn't know that I was doing.
Danielle McCarthy, Untold Sydney.